Hello everyone. Today I'm going to explain about the ankle sprain in a detailed way. Ankle sprain is the most common type of musculoskeletal injury that involves a stretch or a tear which might be partial or a complete tear of the ligaments of a ankle joint. These type of injuries occur when the ankle moves out of the normal range of motion, which can be seen in the sports individuals. Then we'll move on to the epidemiology. The ankle joint is the second joint that is most likely to be injured in the sport, and the ankle sprain is the most common injury in the ankle joint. The most common type of ankle sprains are the lateral ligament injuries, making up approximately 85% of the ankle sprain, and at least the common are acute, medial, and syndesmotic ankle sprain, with adult female having the highest rate of ankle sprain incidence than males and children's. So next is the clinically relevant anatomy. In the lateral ankle ligament complex, the most frequently damaged ligament is anterior talofibular ligament. Here, the mechanism of injury is due to plantar flexion of a foot during the forcefully inversion. And in the case of calcaneofibular ligament and a posterior talofibular ligament are less likely to sustain damaging loads, and these posterior talofibular ligaments are rarely injured and dislocated. As for the medial side, the strong deltoid ligament complex consisting of a posterior tibiotalar, tibiocalcaneal, tibionavicular and anterior tibiotalar ligaments are injured with a forceful pronation, rotation, movements of the hind foot. Next is about the risk factors. It usually occurs in a younger age and high previously any injury of a lateral ankles, then body mass index if higher, and weakness of a hip muscles, especially in a hip extensors, and weakness of a ankle muscles, impaired balance, slow eccentric inversion strength, fast concentric plantar flexion strength, passive inversion joint position sense, reaction time of the peroneus brevis. So next is about the clinical presentations. What are the symptoms we can see, like pain especially when weight bearing on the affected foot, tenderness upon the palpation of the ankle joint, bruising, edema and a swelling, limited range of motion, instability at the level of joint, complaints about a cold foot and a paresthesia, and neurovascular compromise of a peroneal nerve, injury, inversion injury or a forceful eversion injury to the ankle. These are the symptoms, signs we can observe. So next is about the grades of the ankle sprain. Grade 1, which represents slight stretch or a damage to the fibers of a ligament. Grade 2 represent a partial tear of the ligament. Grade 3, which represent a complete rupture of the ligament. Next is the severity of an ankle sprain. According to the grade 1, there will be mild impairment, minimal swelling, tenderness with a little impact on a function. Next is grade 2, moderate impairment, where moderate type of swelling, pain and the tenderness with a decreased range of motion and a little ankle instability can be seen. In a grade 3, it is a severe impairment in significant swelling, tenderness and a loss of function, and a marked instability will be there. The ankle sprain, which we can confirm it by the special tests such as anterior Drawers test, which is for an anterior talofibular ligament, and a talar tilt test, it is for a calcaneofibular ligament, posterior Drawers test for a posterior talofibular ligament, and a squeeze test for a syndesmotic sprain, external rotation test, it is for the syndesmotic sprain. Next, a treatment or a management which can be done by a physiotherapist. First we will move on to the mild ankle sprain. In this, goals are to decrease the pain, swelling, protect the joint from the further injury, and the duration of the patient to recover from an acute ankle sprain, it ranges from 5 to 14 days. Next, for a chronic ankle sprain, the goals are to reduce the pain, edema, restoring the functional movement and stability, and the duration of the patient to recover from the chronic ankle sprain is about 3 to 12 weeks or even more. Next is the treatment plan, that is, we can follow the price protocol. Should recommend a rest for first 72 hours, then icing to reduce the pain and swelling, compression such as the bandages, braces can be used to stabilize the joint, elevating the ankle and the legs helps in the reducing the pain and the edema during the this follows with the inflammatory phase, proliferative phase, remodeling and a maturation phase. First one will go for a inflammatory phase. Here you can give active and a passive mobilization of a foot and ankle, and this is to reduce the pain and to prevent the venous stasis and to improve the local blood circulation and resorption of the edema. This mobilization techniques involves subtalar distraction to reduce the pain, medial subtalar glide, lateral subtalar glide to increase the inversion and the eversion. Next is proliferative phase. It begins after the inflammation has been minimized and it lasts for 4 to 6 weeks. A brace taping can be applied in the beginning of the phase and to protect the joint. Should be applied as soon as the swelling decreases. Next is the remodeling and a maturation phase. In this, a long-term process and represent the final phase of the healing process. The goals of rehabilitation during this phase involves improving the muscle strength, active stability, foot, ankle and the mobility. Then rehabilitation program is like practicing the balance, muscle strength, ankle or foot motion and mobility such as walking stairs or running, looking for a symmetrical walking patterns, working on a dynamic stability as soon as load bearing capacity allows, focusing on the balance and coordination exercises, then gradually progress loading from static to dynamic exercises, from partially loaded to fully loaded exercises, and from simple to functional multitasking exercises, and use different types of surfaces to increase the level of difficulty. The patient should be encouraged to pursue practicing the exercises given during the sessions at a home. The patient is also advised to wear a tape or a brace during the physical activities until the patient is able to confidently perform a static and dynamic balance and a motor coordination exercises also. For decreasing the pain, you can use IFT, ultrasound, and also shockwave therapy, and SWD, and PEMF, the magnet. These are the things you can give additionally to decrease the pain, like about 3 to 10 days you can give all the machines, then you can progress to inflammatory phase. You can give such exercises, then you have to progress it as we discussed before. So this is all about the thing called as ankle sprain.